talk about one of the most important rules I learned in medical school that I carried throughout my practice. And what I'm going to talk about today is this rule and why I think it's so important. Because I think when we talk about this rule, that you are going to remember it. I think all providers, most providers, there's not always nevers, but most providers know this rule, but may not remember it, or they may not have ever like heard it verbalized, but kind of know it. And I'm hoping by talking about this rule that I will help you remember it and I will help you avoid some of the most common mistakes or negative experiences I hear among the transgender and non-binary community. And therefore, you'll be able to provide better care when you remember this rule, and we'll have a little talk about it. So, what I'm going to do is I'm going to tell you the rule, and I'm going to explain to you how I used it in my own practice when I was practicing. I'm going to explain to you why I think it's so important, how it's going to help you give better care to all your patients. And I'm going to share with you how not using it causes a lot of issues among patients, especially in the transgender and non-binary community. Like I said, forgetting this rule seems to be a very common mistake among transgender non-binary patients. So, are you ready? Here's the rule. The rule I learned in my third year of medical school, and for those that don't know, at least for my medical training, the first 2 years were in the classroom. We learned a lot, the sciences, the biochemistry, the pharmacology, all those things. We learned about the different organ systems. We got the base knowledge. And it was in third year, we did a little bit of, observation and clinical stuff, but not much. It was the third and fourth year of medical school that for me was in the hospital, in the clinics, working with patients, assisting with patients, etc. And I share that because that's why this rule was introduced at that time before I was starting my clinical rotations. As a third year, I remember the person that was in charge of our third and fourth years said, have a reason for every question you ask. Meaning any question when you're interviewing the patient, when you're taking a history, when you're finding out what's been going on, what's happening, have a reason for every single question. This is the rule. So that if a patient ever asks you, why are you asking me that question? You can give them the reason. You have an answer. You are being intentional and purposeful. And I remember this all the time. I can't remember if I ever shared that with patients when I was a medical student, but after medical school as a resident, I absolutely did. But even before then, I always remember the rules. So I'd listen, because many times as a medical student, you're observing other people taking care of patients. And I would listen to the questions they would ask. And I would think about, like, why are they asking that question? To help me better understand how to take care of a patient. So it helped me from an observation standpoint. That's why I think every medical student should learn it. And then as I became an OBGYN resident and beyond, I used it, I would say most, if not every single time, definitely in clinic, every single time I interviewed a patient. And I would start out by saying, I'm going to ask you a lot of questions. And I have a reason for every single question I'm going to ask you. So if at any point you are like, why is she asking me that question? Just stop me and ask me and I'll explain it. And I did this every single time. And I was telling this to a friend of mine who is not medical, doesn't have a medical background. And she was like, I have never heard any provider ever tell me that before. And I could see the wheels turning in her head of times where she wished she knew she could have asked that. So I tell a lot of people when I'm talking about patient advocacy, that rule as well. You can ask your provider. If they ask you any question, they should be able to answer why they are asking you that question. And I give them different ways to ask, especially like maybe you don't understand. Maybe you're not really sure what they're trying to get at, and it might help you answer the question better by asking them. So I'm beginning to touch on why I think it's so important to use this rule, to remember this rule. And I even encourage, totally up to you as your own practice, but to even share it with your patients. So here's why I think sharing it with your patients is really important. I think when we share it with our patients, like, hey, every question I ask you is going to have a reason. Like I said, as OBGYN taking very personal history, part of what we do is we have to take a sexual history as part of our practice. Then I really want people to know that it's for a reason, not for any entertainment on my side. just because the information helps me take better care of them. So I think it's important to share this with patients because I think you're going to get better answers. When it is understood what the goal of your question is, then you're going to get better answers. You're like, I'm not really sure. Like, I think of myself as a patient before I ever became a medical student. I remember sitting there and I felt like they were asking all these questions. And sometimes I'd be like, what does that have to do with why I'm here? And I'd be wondering, why are they asking me? What does this have to do with this? What is this telling them? What does it mean? Is this a big deal? Like, I don't know. And so because of that, I would say as a patient, I was less present with the physician because now I'm in my head going, what does this mean? What's going on? Da, 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 da. Whereas if I had just known that rule, if I had been able to say, why are you asking me these questions? Then that might have helped me. It might have helped get me out of my head so I'd be more present. It also might have helped me understand what they were getting at with the question. And I'll give you a great example, not for me personally, but where a question might seem out of left field, but the healthcare provider knows why they're asking it. So say somebody presents with fevers or something like that, and you as the patient present with fevers, and the provider asks you if you've been spelunking. I think I learned that word in medical school because of this. Spelunking means like caving or whatever. I don't spelunk, but going through caves. And you might be like, what does my recreational, things have to do with my fevers? Spelunking, there's a huge risk, well, I don't know, huge, but there's a risk of an infection called histoplasmosis that may not be something we normally would be testing for. But then if we're wondering if the symptoms seem to be one of those options, then knowing that as it's a risk factor. So that might be why, like, you'd be like, why are they asking me if I spelunk? That's a weird question. Well, but if you ask me why, I'll explain. There's risk factors to certain, it helps us narrow down what kind of infections we might be looking for. What are the risk factors here? So there you go. There's a little lesson for you. Now you can see if you can use the word spelunking this week. I think it's just fun to say. But like I said, sharing this helps you get better answers. I also think it empowers the patients. That's one thing I noticed in my own practice is when I came in, and it would be the first thing I say, I'm going to ask you a lot of questions, but every question has a reason. So please stop me and ask me why I'm asking that question. If you're ever like, why is she asking me that question? They felt empowered because even like if you think about my story before, like when I was wondering what was going on, why are they asking, I felt very disempowered. I didn't have enough information. I don't know. And there is that power differential, I think, between patient and healthcare provider. And that, this is somebody that has a lot of information. I don't know what they're getting. I don't know what they're asking, but you empower the patient that I'll teach you. Like, you don't have to know. I'll share it with you. You have the power to ask me and learn if you want, or if there's any question, you don't have to feel lost. You don't have to question. So I think it's very empowering patients to know this rule, and it educates the patient, not only on their rights in that way, but it also educates the patient so that if they do ask a question, like, why are you asking me about spelunking when I want you to take care of my fever and give me some antibiotics? Right? In that case, antibiotics would not help. But anyway, I digress. It helps educate the patients. And I think educating patients was one of my favorite things to do as a provider because of that empowerment, because it gave them something to know themselves better, which I just think is a beautiful thing. So as I promised, I talked about how I used it. I talked about why I think it's important just now to share it with the patients. And now I'm going to talk, as I mentioned, about what this has to do with the transgender and non-binary community. A very common story I have heard among people who are transgender and non-binary that have bad experience with healthcare, is definitely not the only one, but this is a very common one, is how they get asked what seems and feels, and in the stories I've heard, I tend to agree with, inappropriate questioning about their genitalia. It usually happens that they come in for one reason, and the minute the provider knows that they are transgender, then they get asked questions immediately about, have you had this surgery, or something along that lines about being transgender that has nothing to do with why they're there. So I'll give you an example. I had a friend go into urgent care, a friend who's transgender, go into urgent care about a sore throat. And the minute that they heard that he was transgender, they asked if he had had the surgery. And he said to me, like, I don't know what that has to do with me having a sore throat. And I tend to agree, especially the timing of it. The timing of it being right there as soon as they knew that, then that's the first question. They also talked about how the provider was looking at them and kind of looking down in their crotch, to be honest with you, is what they told me, what they reported to me. And another example was like a provider sat down, came into the examining room, sat down with the patient, and looked at the chart. And before, and I don't remember why the patient was there, it had nothing to do with their pelvic region at all. But the provider looked at the chart and said, "Oh, there's something wrong here. It's talking about periods. This is a transgender man. You obviously don't have periods. I don't know how this got in here." And he said, "No, no, no, no. That's my chart. Don't erase that. Don't take that out. That's me. I'm transgender." And the provider, he said, just stopped and stared and asked about surgery um and asked just inappropriate questions about their gender. And I can't speak to why. I mean, I think all of us, I think for those that are healthcare providers, our natural thing is to defend this and like think about, well, but maybe it was the past surgical history. Well, you know, um, they were talking about periods, so maybe that's what, but the patient wasn't there for periods. The patient wasn't there with about pelvic pain. It had nothing to do with anything. So I can't really, and these are just two examples. I mean, just you could go on social media and see examples when people are talking, when transgender individuals are talking about negative experiences. You can hear it over and over again. This, like, all of a sudden they're asking me questions about my genitals, they're asking me questions about surgery when I'm there for a totally different reason. And it feels like out of the blue. Because we all know as providers that we have a way, right? There tends to be, and they're not always in ours, but there tends to be an order of our questioning, right? History of present illness, which means whatever the patient's coming in with, we're going to ask them a lot of different questions about that. Sometimes we will need to ask about surgery, but for a sore throat, I don't need to know about a pelvic surgery in that moment. I'm sure some brilliant healthcare provider will provide a connection. Maybe, I don't know. I'm open to hearing about it. But anyway, like, we ask about what's going on, why they come in. Then, depending if you're OB/GYN, we ask about past obstetrical history. Then we ask about past GYN history. If you're not that, you might skip those. We ask past medical history. We ask past surgical history, medications, allergies, and I feel like I'm forgetting social history, and a review of systems. This tends to be, and they're not always in ours, this tends to be the order of things. So right away when I hear these stories, I'm like, huh, that's out of order. That's not in the usual order again. And that's one of the clues. The timing is one of the clues. The body language that's being described to me is one of the clues. And I can't speak to why providers do this. I think it's a moment when a provider is showing a weakness, not a weakness. They're showing their humanity. That might be a better way of saying it. They're showing their humanity, whether curiosity, and again, humanity, right? The curiosity gets the best of them. I think some of the descriptions I hear, I kind of wonder if the provider's like, oh, I've never met a transgender person before, or never had a transgender patient, and that curiosity gets the best of them. Maybe they're asking these questions at that time to try to share interests, like, oh, you sharing with me transgender, this is all that I know that I associate with being transgender in my mind is, transition and surgery. And maybe they're trying to show an interest in their lives. Maybe. I stretch myself to come up with these reasons because, again, it's not my experience, so I can't speak to it. And maybe it comes from a misunderstanding that I think is true in a lot of society that I completely disagree with, and I'll probably do a podcast about sometime. But this misunderstanding that we think like we need to know. We need to know all about who's transgender. We need to know all about their transition, all these things. And don't get me wrong, there's a medical basis to know about past medical history, past surgical history. But again, as I mentioned, there tends to be an order and there's a time and place, and let's not forget that. So if we think about that rule, what's the reason for your questioning? And if you tell me past medical and past surgical history, why are you doing it during the history of present illness? Why are you doing it at a time when you're asking questions about what they came in with, what the reason that they're there for that visit? And why specifically asking? Because in general, most of it, I was taught that when we ask past medical history, past surgical history, we keep it open and broad. What are the surgeries you've had in your life? And let them answer. And then we might narrow in to help spur on memories and things like that. So these are something that people may, I'm open to hearing other reasons why that happens, but I think humanity is showing is the big thing. And although even like trying to demonstrate an interest, again, I think it's stretching it based on the description of the body language, the timing, etc. But it may sound like a good idea, but I don't think so, because it's, let me reframe it. This is why I think even if you're like, I'm just trying to show an interest, out of all the ways you could show an interest for somebody's gender identity, I don't think asking about their surgeries or their genitals in that moment is it, because let me reframe it. It would be like saying, like, so someone's there for a sore throat, and the minute you find out they're transgender, you say, tell me what your genitals look like. Or you say, tell me what genitals do you have? Right? I don't I don't think any of us would think that's appropriate at the time of, again, presenting with sore throat. Why would you ask that question? Right? And and I do believe the reason this is a bit of showing humanity, I think many of these providers, if I had been present during a lot of these stories, or anyone was present during the stories, and we reflected back to them or showed them a video back, whatever it was of like, you were asking questions about a sore throat, they mentioned transgender, and the next thing you did was ask them if they had surgery. I think the thing was surgery down there, right? I think that healthcare provider would feel embarrassed. They would know that, okay, that's not the way I normally would ask questions. And that's why I think it's just showing some of their humanity, their humanness shining through, because providers are human. Like we're not perfect. We're going to make mistakes. And I don't think we have to be ashamed of making mistakes, but I do think it's important to learn from mistakes. And I had a mentor in medical school that once said, learn from mistakes, but they don't always have to be your own. Like why if somebody else has already made the mistake, learn from them. Why go through the pain yourself? And that's why I'm doing this podcast. That's why I want to have this discussion, because you don't have to wait till you make the mistake. Like, let's reflect. And if you do, that's okay too. Just reflect and think about what was going on. Why did I ask the question? Why was I out of order? What was going on for me, so that you can learn from it. So the next time you begin to feel curious, or the thought goes through your head, oh, I've never had a transgender patient before, I wonder, ooh, red flag. Usually takes me out of my usual order of asking questions. This is not the direction I want to go. I want to remember I have a reason for every question, and probably for the order of my questions. But I think more important than anything is I think about what it does to the relationship. I think of the stories I've heard about this, where a patient feels like the question was inappropriate, or at least inappropriate timing, is that it damages that relationship. It damages that trust. I mean, who feels comfortable having their genitals focused on when they're not there for a reason that involves genitals, right? Like, they're there for a sore throat, they're there for headaches, whatever it might be. Is that then it's like you make the person about their genitals. That doesn't feel good. We want to be seen for ourselves, not for some part of our body, right? We talk about this a lot in medicine in general. Like, the person's not their disease, not their abnormality, not their whatever you're seeing the patient for, their ailments, their symptoms, whatever. That's not the patient. The patient is the person. That's just what's going on for them. This is no different. So that is, I think, the big thing to consider, is to make the relationship with your patients better. And I think all patients, when we remember this rule, I have a reason for every question. I'm going to ask it. I have a reason for the order I ask it in. This is what I do. And I think it'll improve that relationship. I think we'll see less of these mistakes if we ask that. And there might be other reasons, like for patients who are not transgender, not non-binary, that somebody may share something about themselves and a curiosity comes over the provider that may ask a question out of order, not completely appropriate. This staying grounded in this rule is going to help you. Because the other part of it and helping your relationship is when our curiosity takes over, when we jump ship from having the reason for our questions or doing it in the order we typically do it, is then a patient doesn't feel heard. I mean, you just change the subject from sore throat to their genitals, right? Totally different area of the body. We've done a subject change, and it may have the patient feel unheard, that they're not being listened to, that their concerns aren't going to be heard. Even if you bring yourself back to center and are there, I mean, there's not always a never. You're going to hear me say that a lot. You may be able to get back, but you're going to have a little repair work to do. So hold on to that rule. It's going to help your patient care, all patient care. But I really look forward to a day where I can hear the transgender, non-binary community talk about their experience in healthcare, and I'm not hearing this story over and over again of the questioning of their genitals at a time that did not seem appropriate, that did not seem related to the discussion. And forgive yourself if you're the provider that's done this. Forgive yourself. Know that your humanity showed through, and then reflect on it so that you can do better. You can show up as the provider you want to be. Remember the rule. Every question has a reason. I encourage you to share that with your patients so you can strengthen your relationship together, to feel and have them feel empowered, have them help you answer questions better, have them be more educated on their bodies and themselves. I hope you have a great week and continue to engender love.